Hello everyone, I am Dr. Shankar Dey. Welcome to 11th video of NEET-PG 2021 recall question discussion. This video contains 20 questions, 101 to 120, and by tomorrow 6 a.m. by tomorrow 6 a.m. or Monday 6 a.m. by Monday 6 a.m. I will upload all the videos till 200 questions. So stay tuned, subscribe my channel for getting new notification about new video upload. So by today night itself I will upload so that by tomorrow 6 o'clock in the morning you will get every questions from starting from number 1 to number 200. So starting with question number 101, which ligaments prevents growth of spleen downwards? So which ligament prevents growth of spleen downwards? The ligament is phrenicocholic ligament, right? So the ligament is nothing but phrenicocholic ligament. So phrenicocholic ligament prevents downward growth of spleen. Actually, this was case based question. The question was a patient presented with splenomegaly, axis of the spleen was towards the right iliac fossa. Then the question was which ligaments prevents downwards growth of spleen? It is phrenicocholic ligament. Coming to question number 102, submandibular gland tumor history and clinical presentation was there. Then surgery was done to remove the tumor. Which nerve is damaged most commonly? So during submandibular gland excision, which nerve is damaged commonly? It is nothing but lingual nerve. So the answer is lingual nerve is commonly damaged in submandibular gland excision. Next, question number 103. Identify the type of papilla. The option was filiform, fungiform, foliate, and circumvallate. It is very obvious. It is circumvallate papilla. So this is nothing but circumvallate papilla. Circumvallate papilla sees the presence of taste bud on the lateral wall. So this is circumvallate papilla of tongue. Next, 104, aneurysm that can compress optic chiasma. So aneurysm that can compress optic chiasma is nothing but anterior communicating artery aneurysm. Anterior communicating artery aneurysm. Anterior communicating artery aneurysm is the option, correct option for aneurysm that produce optic chiasma. Rest of the options were like anterior cerebral artery, anterior choroidal artery, etc. So right answer is anterior communicating artery. Next, one question was there about blood biochemical parameters. Sodium is very low and potassium was very high. The question was like some sample blood fluid sample is collected from body compartment, sodium potassium chloride as follows. So which is the compartment? Here the answer is, here compartment is which compartment? It is nothing but ICF, intracellular compartment, and rest of the options are like extracellular fluid, plasma, or interstitial fluid. So these are wrong option. In case of intracellular fluid, potassium, it is potassium rich fluid and it is deficient is sodium. Sodium is higher in extracellular fluid but sodium is lower in intracellular fluid. Opposite is potassium. Potassium is higher in intracellular, lower in extracellular fluid. Question number 106, EC inhibitor. Actually this question was given with a very long clinical history. So this was nothing but oligomycin. Oligomycin is the correct answer for EC inhibitor. So oligomycin, actually the question was like a clinical research is going on, some substance when added it inhibit the production of ATP, but when something was there like succinate or succinate or was added, then it can continue, something like that. So very long question, but the question was regarding complex 5 inhibitor. Here oxygen is consumed but ATP is not produce. That means actually they asked about uncouplers. Sorry, not necessarily uncouplers. No, they asked about the OTP production hampering agent actually, or complex 5 inhibitor. Complex 5 inhibitor. So that is nothing but oligomycin. Next, 107. A patient presents with anemia bone. Then one image was given. I have not downloaded the image because three images were there, because only one question in the NEET-PG, in which three images or four images were given, that is nothing but Gaucher disease. One of the image was showing a crumpled tissue paper appearance, cell with crumpled tissue paper appearance, that is Gaucher cells, crumpled tissue paper appearance, and the Gaucher cell enzyme deficiency is nothing but glucocerebrosidase. So the answer is glucocerebrosidase is the answer for this question. Next, coming to question number 108, image based question. PDH complex image was there from biochemistry, and enzyme, three enzyme were there, enzyme 1, enzyme 2 and enzyme 3, and the question was asked about what is this enzyme 1 and what is this enzyme 2. Enzyme 1 is nothing but PD PDH itself, that means pyruvate dehydrogenase. So pyruvate dehydrogenase is PDH complex enzyme 1, and second one is dihydrolipoyl transacetylase. Dihydrolipoyl transacetylase, not dihydrolipoyl dehydrogenase. Another option was there, dihydrolipoyl dehydrogenase, but here the answer is pyruvate dehydrogenase and dihydrolipoyl transferase. So this is the answer. Next, question number 109. A patient came for blood testing at 7 a.m. He had dinner at 8 p.m. in the previous day. So after 11 hours, he is coming for blood testing for examination of blood sugar. So in during this time 7 a.m. the source of glucose in his blood is, the question was like liver glycogenolysis, muscle glycogenolysis, gluconeogenesis, etc. Here the answer will be liver glycogen. So the source of liver glycogen by the procedure of liver glycogenolysis, it is giving it is adding glucose in blood after 11 hours of fasting. So Chhattisgarh, a question was from Chhattisgarh. Pure motor paresis, muscular weakness was there. I think this question, pure motor paresis from Chhattisgarh, about nothing but letharism. It occurs because of ingestion of Fesaridal. So this contains some poison like boa. This causes neuroletharism that can cause pure motor paresis or muscular weakness. History. So which history is important? History of diet. So diet history is important. So history of diet is important to rule out the disease. Next, question number 111. Waving of neck, ankle edema was there. Chill chest diagnosis. Very typical case. All of you know, I think, Turner syndrome. So Turner syndrome is the diagnosis for this case. Next, question number 112. A patient missed OCP 4 pills on different days, not continuously for 4 days, different days. It's different days for last 2 weeks. What is the best management? Here, best management, I think, though I am confused little bit, according to me, I think it should be like uh, continue OCP. Sorry, continue one tablet immediately. Continue one tablet immediately, and then continue the OCP packet, whichever the patient is using. Then use some emergency contraception if the patient had intercourse in last 72 hours. So last 72 hours, I think it was mentioned. So I think according to me this can be the answer. And another thing, I have revised all the answer after returning from the examination hall. That's why I am so much fluent to tell you the answers, but my examination was not at all good. Next, 113. A patient wants to conceive, but patient having complaint of profuse discharge at day 3, non-foul smelling discharge, non-itching. After so much extensive research, I have find out all the questions, 200 questions. So non-foul smelling, non-itching discharge, A3, and many faculties told that this is nothing but physiological. So according to many faculties, it is physiological because non-itching means not trichomonas candidiasis, not foul smelling, less likely to be bacterial vaginosis, etc. So after excluding all the options, it is physiological according to all the faculties. Next, question number 114. Multiple abortion on different times, like options are there like 8, 11, 14. I have forgot actually three gestational weeks are there, multiple abortion, different trimester abortion, and there of history of preeclampsia present. So the diagnosis, I don't know whether it is correct or not. I think it is APLA, antiphospholipid antibody syndrome. Next, 115, 36 weeks pregnancy on labor, multiple tender vesicles presence on the vulva. This is nothing but active herpes. So herpes zoster infection. So in this case, best management 36 weeks pregnancy on labor is cesarean section. So caesarean section is preferred in this case. So LUCS, LUCS, lower uterine caesarean section plus acyclovir. I think this is the answer according to many national level faculties. 116, OCP intake history was present. The patient is having 6 months amenorrhea, UPD positive. Means patient is pregnant. So what is the best test? Sorry, this is not 6 months, this is 6 weeks. So 6 weeks amenorrhea, best test for gestational age determination is what? CRL, crown rump length determination. So CRL is the best to determine the gestational age at 6 weeks of amenorrhea. So this will be the answer. CRL is in first trimester. It is best to determine gestational age. Next, 117. A female patient, fibroid presence in both cornu of the uterus. Patient is infertile. What is the best management? According to some faculty, it is controversial question, but many faculties, maximum faculties, they are telling in their respective groups, it is artificial reproduction technology or ART. Next, question number 118. A atrial fibrillation patient, on echocardiography there is no thrombus on the heart, best drug for prevention. I think this is dabigatran. Dabigatran, but it is also controversial. Some people are saying this is aspirin plus clopidogrel. I don't know what is the actual answer. If you know, please do comment on the comment section. So if I am wrong in any question, please do comment in the comment section so that I can further review the questions. Uh, Next, 119, 36 weeks pregnant female with prosthetic heart valve. Patient is on warfarin. So this is 34 weeks pregnancy. Next step, in 36 weeks pregnancy, I have to stop warfarin. So stop warfarin and start low molecular weight heparin. Start low molecular weight heparin. So this will be ideal for 36 weeks pregnancy. Next, leprosy patient, multibacillary leprosy. On treatment, there is redness and tenderness of exsticulation. One image was there. I have not downloaded the image. So there was redness. One image showing the redness of exsticulation. That means this is nothing but type 1 lepra reaction. This is type 1 lepra reaction. So what will be the ideal management for type 1 lepra reaction? Yes, the answer is steroid therapy. Do we need to continue the multibacillary leprosy treatment or not? Would you stop or would you continue the multibacillary leprosy? Yes, tell me. Yes, you will continue the treatment for leprosy, multibacillary leprosy. So this is the answer for 120 question. In the next session, I am going to discuss 121 to 140, means 120 to 140 questions in rapid fire manner. So stay tuned. By tomorrow 6 a.m. I will upload all the 200 question. Till then, do subscribe the channel Dr. Shankar Dey. If you subscribe more, I will do it very fast. So do subscribe the channel Dr. Shankar Dey. Thank you for watching and do comment about the questions collections, research and obviously recall. Thank you everyone.